So breast reduction surgery is a surgery to make the breast smaller and usually do an uplift at the same time to make it sit higher, because usually larger breasts are drooping with the weight. And we usually perform this either for cosmetic reasons, but also more importantly for other reasons such as back pain and shoulder pain and to lift the breast. I think people have a misconception about how big that operation is. It is considered a major surgery. However, it is not as extensive as people usually think. And most patients, after I do this operation, are surprised about how not very painful it is and how fast they recover. So most people are fine with just wearing a bra and taking simple painkillers like paracetamol and ibuprofen. Of course, like any operation, there are risks, but most of these can be managed with good surgical planning and good technique. But the most common complication is a little bit of delayed wound healing, especially in the area where um, the T junction is, which is the most common type of reconstruction, which is the anchor type scarring. But there are other risks like collection of blood or fluid underneath the wound, or chance of losing the nipple, or having some of the fat die. But all of these are manageable, and they rarely happen with good techniques and good patient selection. It usually takes anywhere between 2.5 and 4 hours. Most of the time, it's around the 3-hour mark. Most people are fine after a week or two, but you will need to continue to wear the bra for about 8 weeks in total afterwards. And depending on how the wounds heal, you might require further visits for wound checks. But in terms of returning back to work, for example, it's probably up 2 weeks' time would be fine. But obviously, strenuous activity and other things will have to wait longer.